Hi, my name is David Rasmussen. I'm one of the nurses here that works with our total joints team at Bellin. I'm here to walk you through the preoperative and postoperative education for our joint replacement surgeries. First off, I would like to extend a thank you from all of our surgeons and the rest of our team here for choosing Bellin for your care. We have quite a few of our surgeons here with some videos for you to click on and to see a short thank you from them. I would also like to introduce you to the rest of your team. So the main teams will have a surgeon, and then there is a physician assistant or a nurse practitioner who will be working right alongside with the surgeon. And then there are nurse care navigators that will also be assisting you throughout your journey, helping you with any questions that you have and making sure that things go smoothly for surgery. Next, we do also partner with the Prepare team. Their main job is to help make sure that you are medically cleared for surgery and that it is safe to proceed. So that consists of a nurse practitioner, physical therapists, as well as nurses to help make sure that you're ready for surgery. Next, we have the hospital team. So that's a group of nurses, physical therapists, occupational therapists, as well as case managers who will make sure that you are safe and ready to go home after your surgery. Last but not least is your support person. We do ask that everybody that comes in for surgery does have a support person who can stay with them after surgery, make sure that they can get anything they need, and help them get to any of their appointments afterwards. Next, we just have a few short clips here for both surgeries, the knee replacement as well as the hip replacement. Now, these don't show an actual live surgery at all. They are just diagrams for you to look at just to help kind of explain the process a little bit better for you. Next, I would like to cover realistic expectations. So there are a couple of things that we do like to lay out for our patients when they sign up for surgery. First and foremost is pain. Now, the goal of this surgery is to help reduce your pain, get it to a much better level where you're able to live with it and do the things that you love to do. But we do also like to lay out that there is going to be pain right after surgery. Next up is driving. Most patients always ask me, when will they be able to drive after surgery? We have a couple ground rules for that. First off is that we ask that you're off of any narcotics for at least 24 hours before driving. And if, per se, you're having surgery done on your right side, you need to make sure that you have enough strength to slam on the brakes and safely stop if you needed to in emergency. And as a general rule of thumb, we ask that you don't start driving until you come in and see us for your 2-week post-op visit after surgery. Next up is work. So with our patients who are still working, we do plan for them to be off of work for the first 12 weeks. But when you come in and see the surgeon for your 6-week follow-up, they could have you return to work sooner if you are feeling up to it. Next is traveling after surgery. We do ask that you refrain from traveling for the first 6 weeks after surgery, possibly longer. If there is any travel that you're looking to have done within those first 6 weeks, we do ask that you call the surgeon's office and discuss that with us. Next is physical therapy. So for our patients, we do have you go to physical therapy after surgery just to help work on strengthening your joint after surgery, making sure that you're going to get good use and get a long life out of that joint. Next is recovery time. So recovering from surgery, it will limit what you are able to do both physically and mentally. We tell patients that you need to just take it day by day and listen to your body. It can take up to 3 months to resume most activities, and it can also take up to a whole year for you to get back to your maximum strength and endurance. Last but not least is the post-op appointments. So after surgery, we do have you come in at around the 2 to 3 week mark for a post-op visit with the nurse practitioner or the physician's assistant. And then we will have you come back at the 6-week mark to meet with your surgeon again, just to see how things are going. So now we're going to talk about preparing for surgery. So you've decided that you want to move forward with surgery. Now there are a couple other things that need to be taken care of first. First on our list is the dentist. So we do ask that you have been seen by a dentist within the past year and had any dental work taken care of, because we want to make sure that there is little to no risk for infection at all in your mouth that won't jeopardize your joint replacement. We do ask that all dental work is completed at least 2 weeks before surgery, and then we do also ask that you don't have any dental work for 3 months afterwards. Next up is antibiotics. We ask that our patients are not on any antibiotics the week before surgery because we want to make sure that any infections that may be going on are resolved. Next up is skin. So this one is really important. We want to make sure that the skin around where your incision is going is clean and the skin is intact. So that means there's no rashes, scrapes, cuts, bug bites, acne, blisters, burns, you name it. Anything that opens up the skin causes a major risk for infection. So we want to make sure that your skin is intact. Next is nicotine. We do have all of our patients be nicotine free for at least 6 weeks before surgery. This is to help reduce any risks for infection and delayed wound healing that can come with nicotine use. Next is medications. So our prepare team works with us to help make sure that any medications that need to be held before surgery are held appropriately, and any medications that need to be continued are continued. Immunizations, we do ask that you refrain from receiving any immunizations the week before surgery and then for 2 weeks afterwards. Insurance, so we do have a financial team that will help you get any prior authorizations for surgery completed and work through with your insurance company. And the one thing we do ask though is that you do reach out to your insurance company to check on how many physical therapy appointments that you have covered in your plan. We want to make sure that you have the adequate amount of visits left to properly recover from your surgery. Next is FMLA. For any patients who need FMLA paperwork filled out, we do ask that you just send them to us. We do have our fax number listed in the binder that you have received. Lastly is over-the-counter medications. So we do have a couple medications that we do ask that you have for after surgery. Next up, I do want to touch on a couple of reasons why surgery may need to be postponed. First one is medical clearance. Sometimes there may be other medical issues that you're experiencing that we need you to have figured out before being able to proceed with a joint replacement surgery. Next is infections or poor dental health. If there is any active infections in your body anywhere, including your mouth, we want to make sure that those have cleared up before proceeding with surgery. Next is blood thinners. Depending upon what blood thinners you may be on before surgery, we want to make sure that those are held appropriately and are able to be held appropriately before surgery. As I touched on before, impaired skin integrity. If you have a cut or a scrape or something right where the incision is going to be, we may need to postpone and let that area heal before proceeding with surgery. Cortisone injections. Now, if you have had a cortisone injection into the joint that you are going to be having replaced, you do have to wait for a minimum of 3 months before proceeding with the joint replacement surgery. Tobacco, drugs, alcohol use. If you are continuing to smoke before surgery, we will have to postpone that until you are able to be nicotine free for 6 weeks. We do also ask that you try and cut back on your alcohol consumption the 2-week mark before surgery. There are also some considerations with BMI as well. If your BMI is above 45, we would have to postpone surgery and wait until you're able to get that number below 45. For our patients who are diabetic as well, we want to make sure that your A1C is less than 7.5 or less, because we want to make sure that your body will be able to appropriately heal after surgery. And then tobacco use again, if you are still using, we would need to have to postpone surgery. Next, I'd like to just discuss the anesthesia that we use a little bit. The primary option that we use is a spinal anesthesia. So this is an anesthesia that numbs you from the waist down. You will also be sedated during surgery to make sure that you are comfortable and that you don't remember anything. So some of the benefits to this would be decreased in nausea and vomiting afterwards, decreased pain, decreased confusion, as well as decreased risk for blood clots. This type of anesthesia does wear off, typically in a couple of hours, and you're able to get up and start walking right after surgery. The surgeons do also utilize a local anesthetic around your joint replacement. So this is just injected into the tissues around the joint to help with pain control, keep swelling decreased, as well as help you get up and start moving right away. So now for some patients, a spinal is contraindicated, so we would have to utilize general anesthesia. So with general anesthesia, you will be put into a deep sleep that does require a breathing tube, but this can be done safely. There is no increased risk with using general anesthesia, except for a couple of other side effects, like some increased confusion, drowsiness, that kind of hangover effect, and some nausea. So now I kind of want to jump into when things start getting closer to surgery. So in the 2 to 4 weeks before surgery, This is when we are going to have you try and meet with our prepare team just to make sure that you are medically cleared for surgery. We'll also have you go through something that we call prehab, which is a physical therapy visit where you'll learn the exercises that we want you to do after surgery, before surgery. So this is just to help you start strengthening up your joint, get ready, and get a kind of step ahead for surgery. Now, once you get into the 2 to 3 weeks before surgery, this is kind of the time where we want to make sure that you've got a caregiver who can stay with you for 72 hours after surgery. And we also want you to try and make sure that you're removing anything that could be a hazard at home. So this includes things like throw rugs, small pieces of furniture that could get in the way. We want to make sure that walkways are adequately lit and make sure the things that you need are easily within reach for after surgery. Now, once we get to the 2 weeks before surgery, we do ask that patients start limiting their alcohol consumption. So for women, we ask that they have 1 standard drink per day, and for men, 2 standard drinks per day. We also ask that any dental work or cleanings are completed at this time. Now we're getting down to the week before surgery. So with that, we want to make sure that there are a couple medications that you stop taking. So this does include things like NSAIDs, so that would be things like ibuprofen, Advil, naproxen, Aleve, meloxicam, all of those medications. We want to make sure that you stop those. One exception to that is Celebrex. Celebrex is safe for you to continue during that week before surgery. We do want you to also hold any vitamins, supplements, and herbal medications that you are taking. We also ask that you make sure that you are following the recommendations that you get from the prepare team regarding your prescription medications. We want to make sure that you've got a ride set up for after surgery. We also ask that you remove any nail polish, artificial nails that you have on. And we also ask that you stop shaving, especially on the leg that you are going to be having surgery on. We just want to make sure that there are no small nicks, cuts, or anything like that that could come from shaving. We also ask that you don't have any pedicures or manicures at this time. Just a couple of things that we want you to be conscious of. We want you to be looking out for any skin issues such as these. Now we're down to the evening before surgery. So our surgery prepare team will be calling you to Our surgery schedulers will be calling you to tell you when you are going to be arriving to the hospital for surgery, but they will also be letting you know what time we want you to stop eating, which will be 8 hours before surgery, and stop drinking, which is going to be 3 hours before your surgery time. Now, our surgeons do ask that you drink a 20-ounce sugar-free sports beverage within your hour of arriving to the hospital. Now, this will overlap a little bit with the 3 hours that we ask that you stop drinking. And that is okay as long as that sports beverage is the last thing you drink. Clothing the night before, we want to make sure that when you go to bed, you're wearing clean pajamas, you have clean bed sheets, and that you have done the appropriate skin prep that our prepare team will go through with you. We also have a list of things that we want to make sure that you're bringing with you to the hospital. So we do ask that you bring your binder with you, as well as up-to-date insurance cards, photo ID, and an up-to-date medication list. We also ask that you bring some nice loose-fitting clothing for you to wear the day of surgery that's easy for you to get on, as well as we ask that you pack an overnight bag just in case. Now, most of our patients will be able to go home the same day, but just in case something were to happen, we ask that you have an overnight bag ready. We ask that you bring any assistive devices like walkers or canes with you to the hospital so that you can use those when you're done with surgery. Now, we've gotten to the morning of surgery. We want to make sure that you take any medications that you've been instructed to take by prepare. There's a second skin prep that you'll have to do, a second shower. And then you'll arrive at the hospital and you will proceed to the pre-op area. But first, I just want to give our locations where surgery would be. If you're having surgery here in Green Bay, that would be done at Bellin Hospital over on South Webster Avenue. And if you are having surgery in Oconto, that would be at Bellin Oconto Hospital on Arbutus Avenue.